The Center for Individualized Medicine, Story by Story, a video series on topics in individualized medicine at Mayo Clinic.
On today's episode of Story by Story, we're in the Harwick building at the Center for Individualized Medicine. We're going to talk about the Diagnostic Odyssey with Dr. Klee and Dr. Lazaridis. There they are. Good morning, Dr. Klee, Dr. Lazaridis. It was so interesting when I first started at SIM to hear about the Diagnostic Odyssey. Can you tell me what that is?
Many patients, they have a symptom or a sign, and they go to a doctor and they have a diagnosis in a day or a few days or a week. But there are a few individuals who have a disease which, after extensive testing, there is no diagnosis. Those are the Diagnostic Odyssey cases.
Can you tell me the tools that you use with the Diagnostic Odyssey?
So for the Diagnostic Odyssey, what we do with our patients is sequence their DNA. It's often done using exome sequencing, which is a way to look at all the coding regions in a genome. And we'll sequence the patient, and a lot of times family members, parents, or sometimes affected siblings, if there's more than one person in the family that has the disease. And then we use various types of informatics analysis to try to hone in on the answer by taking those results and comparing to external knowledge and databases that we can get our hands on.
And are you able to find answers for those patients?
That's a great question. I think about the perceived idea right now is about 25 to 30% of patients have an answer, which means about 70 to 75% don't. Now, for those that get an answer, it's hugely beneficial because they've been searching for this answer for a long time, and finally they've got some resolution to what they're looking for. But for the rest, we're actually doing quite a bit of work at Mayo to try to look above and beyond that sort of first 25%. So we do more type of testing. We look at RNA with RNA-seq, potentially whole genome. We do protein modeling, so we actually look at the variants and how they impact proteins in a structural sense. And we even go into the wet lab and do some experimental approaches to look at variants to try to understand their function. Using all that, we actually try to get to a better answer than the 25%. We're hoping to get to 40 or 50% of the patients that we can provide answers for.
Is this something that clinically patients can be a part of, or do you only offer it through research?
We do this for clinical purposes for the last 3 years, so this is what we're here for, to several patients come back with clinical answers to their questions for which they have seen care for many, many, many years. The average person with Diagnostic Odyssey may have seek attention from medical professionals for 5 years or more. This doesn't mean that we don't do research for the cases that we cannot be able to solve, and it's about 75% of the patients. It's a clinical service, that's why we're here for the Mayo Clinic, but we like to have research outlets so we can move forward in the next generation and improve these processes.
Here's our floor. Thanks so much.
Yep.
Thank you.
Thank you.
The Center for Individualized Medicine, Story by Story, Mayo Clinic's elevator ride through patient care, education, and research.